light of the VA scandal and how we're actually providing benefits through the VA to our returning service members, I thought it would be interesting for us to have a candid conversation with several people. The first of those is a good friend of mine. His nickname is China Boy. That's because he served with the Chinese Nung in Vietnam, did 2 tours as a Green Beret there, was wounded in combat, and highly decorated, a very close friend of mine. He also worked for a while at the Veterans Administration here in El Paso. Secondly, I wanted to interview our Congressman Beto O'Rourke. He and I served on City Council together, and I wanted to get his take on what it's really going to involve in order to increase the benefits and make sure that we take good care of our veterans once they come home. The question is, regarding PTSD treatment, do you think the VA clinic is doing enough, and what do you think the problem is?
I believe it's my opinion that the problem here is at the VA clinic in El Paso is economics. We don't have enough psychiatrists and psychologists. What we need is for these psychiatrists and psychologists to be paid equivalent to what is being paid at Beaumont, what is being paid on the outside, and economics is the only thing that'll bring them back in here. Our VA doctors should be paid more than the civilian type Beaumont and civilian community. If we pay our doctors more than civilian doctors,
then you can recruit more doctors.
Then you will be able to recruit more doctors into the VA. But what we're having here, what I see in my opinion, is that the doctors that come in here, the psychiatrists and psychologists that come here, they come in with a foot in the door. What they're doing is they're looking around to see where they can get better payments. Their payments are going to be in Beaumont and on the outside. Those are so economics is a big thing. What a congressman should do is fight for our veterans and see if we can get a hospital or pay our psychiatrists and psychologists more so than the civilian type doctors who are outside of the rim of the VA. That is the only thing that will draw our doctors to take care of our veterans. Money.
Thank you, China Boy, and thanks for your service.
Thank you.
Okay, well, welcome to this episode of Fireside Chats. It's going to be a very interesting chat because I have a good friend of mine, our Congressman Beto O'Rourke, who is serving us in Washington, D.C. He's very passionate about veterans issues, as am I. You know, my daddy was a World War II vet, served on the USS Flasher, won the tonnage record for the most Japanese ships sunk during World War II. And I was a Vietnam combat veteran along with my brother Eddie. The two of us are actually in Vietnam at the same time. And then we have our oldest son, John, just returned from his combat tour in Afghanistan. So the Cooks have a long and honorable tradition of veteran services. The Texas Veterans Land Board, which is part of the responsibilities for the General Land Office of Texas and the office that I'm hoping to get elected to, is responsible for veterans loans. That happened right after the Korean War, when interest rates were so high that Texas decided that they would help veterans a little more than they were being helped around the nation. We also have the Texas Veterans Cemetery Program and retirement homes for veterans. So those are some of the issues that the Land Board has. But the reason I invited Beto to be here with us today is because of the current things that are happening with Veterans Administration and the concern, the national concern about it. So, Beto, the simple question that I wanted to ask you is, we made a pledge to our veterans, all of them, said service in these combat roles, and when you come home, we'll make sure we take care of you. So is that a promise that we can actually live up to today?
I think it's possible to live up to that. I think it's very clear that we are not living up to that commitment today, and it's really, I think, one of the most significant disappointments in many that we have in terms of how our government should work and where it doesn't work. These men and women, men like your father, like you, like your brother, like your son, who have literally put their lives on the line for this country and sacrificed their comfort and their safety for the rest of us in America, did so with the explicit understanding that when they returned and transitioned into civilian life, their healthcare needs, their service-connected disability needs, their educational needs, especially the post 9/11 GI Bill for our young returning veterans, those were going to be met by the federal government. And we know from the sensational scandal in Phoenix, we also know from recent revelations in El Paso about the gap between care that was promised and care that was actually received and accessible to veterans here, that we're not able to meet that commitment. And it's not simply an issue of resources and funding. The VA last year returned $400 million in its budget that went unspent at a time when we're having a really hard time providing timely care to veterans. I think the issue is accountability and leadership. And that's what's missing throughout government at all levels when we try to connect veterans to the care that we promise them. And so developing a culture of accountability and responsibility and centering what we do at the VA and the various organizations at different levels of government that help veterans, focusing that on the actual outcomes of the veterans is what is needed. And I've got to say, just from working with you in the 6 years in which I served on city council when you were the mayor, actually reading the book that you lent me that detailed your dad's service in World War II, knowing about yours and your brother's service, your son's service, and seeing you as the mayor of our city when we were one of the most hard-pressed cities in terms of resources, as one of the poorest in terms of property tax base, and yet delivering exceptional service to citizens who really needed it. I think the experience that you have, the leadership traits and qualities that you bring to this, your ability to convene stakeholders around an issue and get resolution to it, gives me a lot of hope that at least at the state level and what this office could do for veterans in Texas, that we have the potential to change and improve the leadership here. So it's got to happen at all levels of government. And certainly we need to see that in Washington, D.C., we need to see that at the VA, but certainly there's an extension of that issue and a potential solution at the state level.
You know, one question that keeps coming up is we know about Phoenix, and thanks to you, we know about the research that you did here, which showed some of the delays in services. Is this widespread in all the VA clinics? I was at a recent VFW convention in Dallas, and a person from the Veterans Administration came in and actually told us that some of the VA facilities are really being run very efficiently and very dedicated people, but he admitted that we have some bad players in there. So is this really widespread? Is it nationwide? What's your perspective on that?
You know, I think the reason that the scandal in Phoenix, where we learned that the VA there was maintaining secret wait lists that were not reported so that the managers there could earn their bonuses for meeting the 14-day wait time deadline for new appointments, that may have resulted in the deaths of dozens of veterans. The reason that story resonated beyond the tragedy of denied care and perhaps deaths related to that denied care is that it seems to corroborate what so many veterans in El Paso and really throughout the country have experienced, which is this: if you can get into the VA, typically the care is quite good, if not excellent. I'm routinely told by veterans in El Paso that the doctors treat them very well, the outcomes from their procedures and surgeries are positive, and that generally the staff is respectful to the veterans. But I'm also told by a very large number of veterans in El Paso, and we hear this in other communities across the country, that getting that appointment is just so difficult, that it is months out to receive that appointment, it is routinely canceled, And sometimes it's not possible to schedule that appointment at all, especially when it comes to mental health care. So the answer is yes. I think we have a problem far beyond what was uncovered just in Phoenix, one that we see here in El Paso, and one that's important to differentiate between the care that's actually received, which is quite good. And we need to thank the doctors and nurses and frontline staff and providers at our VA facilities like the one in El Paso. But we have a problem when it comes to accessing that care and scheduling an appointment and having the resources necessary.
Do you think it's
to make
mainly
sure everyone can get in?
administrative issues, not knowing how to properly plan and implement, rather than not having the proper resources?
I don't know. It's a great question. I think it does have more to do with the administration of existing resources, of what it will take to recruit the kind of providers and keep them here once you're able to recruit them in the first place, of maintaining a growing population of veterans, many of whom, especially in today's wars, are surviving wounds that would have left them dead on the battlefield in previous wars. And so as the VA has increased the population that it serves, as it recognizes conditions that are presumptive, like exposure to Agent Orange, and as we have more veterans coming back with traumatic brain injury, with post-traumatic stress disorder, we are stressing a system that may not have been built to capacity in the first place. But that is not to excuse the administration. And I think that we need to hold ourselves and those who administer these resources for veterans to a higher standard. I'm encouraged that the president's looking at somebody like Bob McDonald, who's got his background at Procter & Gamble in managing a very large organization that serves billions of customers, to perhaps bring some of that management, organizational skill and experience to the VA. But certainly we need to do much better than we are.
And what are we doing nationwide for a temporary fix, and then what's the long-term implications?
The VA within the last month has announced an Access to Care initiative that has committed over $300 million to get veterans care in the community. In other words, in El Paso, if you've waited or are waiting more than 30 days to see a doctor or a provider at the VA, 1.9 million of that 312 million has been made available to El Paso to seek that care in the community.
So it's like TRICARE for active duty folks.
Exactly. Veterans will now have a choice to seek care in the community, to go to a doctor or a therapist or a counselor or psychologist in a private hospital or private clinic if they can't be seen in the VA in a reasonable period of time. And that may be a model going forward that we choose to employ. If the VA cannot develop the capacity to see every veteran who needs care, let's introduce some competition into the system and allow veterans to seek that care outside of the VA.
That's a two-edged sword, though, because in El Paso, if you just look at the number of doctors per 100,000 people, we're shortchanged. So for a community like us, that may not actually be the solution. Maybe someplace like Dallas or Washington, D.C. or New York City might work, but I'm not sure that we actually have the resources, even in the private sector, to deal with it here.
It's a great point. El Paso is one of the most underserved communities in the country for medical care. We have one of the worst doctor-to-patient access ratios. So it brings up a really good question. If you're going to allow veterans to go into the community to seek care, where will that care come from? One of the bills that I've co-sponsored in the House, and I expect it to pass, is a bill that would create more graduate medical positions in underserved communities like ours. And so partnering with someone like Texas Tech, the new four-year medical school, the Paul Foster Medical School here in El Paso, additional resources to defer or defray loan expenses carried by these graduate students to get them to practice medicine in here, and specifically with the VA or even just in our underserved community, long-term will help to expand the capacity. Short-term, we need more resources, and we're pressing for those at the VA to recruit the providers that are already out there in the country to come practice medicine in El Paso. As of last month, we had 20 funded but unfilled positions at the VA for mental health care. So we're asking the local administrator to increase the funding for those positions to make it a little bit sweeter to recruit those folks down here. I have, and I know you would as well, made phone calls to some of the folks that we're trying to recruit to El Paso to let them know that this is a wonderful community to live in, great quality of life, and they can do more good here in El Paso, arguably, than they could do anywhere else in
Yeah,
the
I
country.
think a lot of times what they do is they look at that patient to doctor formula that we have, and that scares a lot of people. Then they look at the compensation and don't realize, well, the cost of living here is actually lower, so that those things don't factor in.
Right.
You know, Washington has, on a legislative record, it has a reputation of being gridlocked, that Democrats and Republicans can't seem to agree on anything these days. And I think a lot of it is because people don't like President Obama, and they've, as Rush Limbaugh said at the very beginning of Obama's tenure, was that his job was to make sure that he was not successful. Do you think that this is an issue that we could actually see some cooperation? Are both sides ready to address the veterans issue?
I think so. The House Veterans Affairs Committee, on which I serve, is reported to be the most bipartisan working committee in Congress. And routinely, bills that are considered within the committee pass out of committee unanimously with full Democrat and Republican support. A bill that I introduced a week ago, the Ask Veterans Act, which would require the VA to survey veterans to find the real wait times and the real facts about the VA's performance, was a bill that I introduced with Republican Bill Flores of Texas. And every bill that I've introduced on veterans issues has had Republican support. And likewise, when Republicans support introduce good bills in that committee, I'm always ready to support them. So yes, we'll be able to work on this issue in a bipartisan manner, and hopefully that serves as the model for addressing other tough, seemingly intractable issues in the Congress and in the U.S. government, working in a true bipartisan fashion. The folks that I represent in El Paso, be they Democrat or Republican, really don't care, I find, so much about my party affiliation or whether I'm doing what the Democrats want me to do. They really want me to solve and be part of the solution to the problems that face El Paso, like this
Well, you're
access to
definitely
care.
the right guy for that. You've always been a bipartisan problem solver.
Thank you, appreciate that.
Is there anything else you'd like to say before we wrap up? I know you have a busy schedule ahead of you for the day and the rest of your life, actually.
Well, I just want to say, as I told you before we began the interview, I'm just really pleased that you're running for this position, that you have made veterans issues a central component of your platform and what you want to do for everyone in Texas. And I think that that speaks to your leadership, your ability to identify a way in which an office is going to move a community, or in this case, a state forward, and especially help a population that has earned the care and support that was promised to them by this country. So I wish you the best of luck on your campaign, and certainly will be supporting you and hope to see you victorious in November.
Well, we'll see if God and the people willing, I'll win.
Well, thank you. Thanks for having me on
Okay,
your
well,
program.
thanks for being here. Good to see you again,
Good to
Beto.
see you as well.
Okay.
Thank you.